Today, we'll be discussing plastic surgery and its related matters. Now, the World Health Organization recommends one plastic surgeon to every 100,000 residents. That means in Ghana today, we need at least 300 plastic surgeons, but we only have 21. Why is that? Why are the numbers so few? Also, beyond the misconception of most people that plastic surgery is all about getting the right body enhancement and shape, what do we actually understand in the areas of plastic surgery, and how well related or regulated is a cosmetic surgery in Ghana? To discuss this and more, I have with me Surgeon Naval Captain Kwesi Okumanin Nsaful, a plastic surgeon and the head of Plastic Burns and Reconstruction Unit at the 37 Military Hospital. My name is Nana Akusia Kunidwa Santi Samuels, and you are watching The Hard Truth. Doc.
Yeah.
How do I say it? Like, welcome to The Hard Truth, sir. It's
Thank
good
you.
to have you. Thank you so much for being here.
I'm
Right.
honored. Yeah.
Great. Now, people talk about, or when you hear plastic surgery, like I said earlier, they mostly associated with the enhancements of breast, Botox, and getting the hourglass shape. But these are just subsets of the larger field or the larger picture. Let's start from the onset. Give us a brief overview of what plastic surgery entails.
Okay, so the word plastic surgery, plastics comes from the Greek word plastikos, which means to mold or recreate. Plastic surgery aims at recreating, correcting, molding deformities and abnormalities, be they congenital or acquired. Congenital means people may be born with a deformity, and so it needs to be corrected. So plastic surgery is actually surgery from head to toe. It's said that the plastic surgeon is the surgeon of surgeons, because we have situations where other surgeons would need the assistance of a plastic surgeon. So it's surgery from head to toe. We are correcting, we are putting things right, we are remolding.
But Doc, we know it started after World War II, when people had, deformities after the war, and there was a need for us to put all those bodies in shape. So now, like I said,
so
why
the
do we
the father of plastic surgery was an Indian doctor known as Sushruta, who around BC 17 was doing rhinoplasties. In those days, the punishment for stealing was to cut off your nose. And so people walking around with their noses deformed had to go see him, and he was creating noses for them. Plastic surgery, modern plastic surgery developed mainly after World War I, where people had various injuries from the war. And we were having surgeons now, after keeping them alive, had to try and correct the deformities on their faces. So we learned a lot from World War I. Actually, some of the methods that I still use for some of my surgeries were methods that have been developed after they started using them during World War I. A lot of the plastic surgeons, or the modern plastic surgeons, or the father of modern plastic surgery, are military men. They are doctors who are in the military, who had to take care of deformed and injured soldiers. But plastic surgery is, let me say this, that with the cosmetic surgeries that I do, it's maybe 1 out of every 20 surgeries that I do. I do surgeries on the face, I do hand deformities. Or
We'll get to that, but looking at the reconstructive surgery, what is the situation like in Ghana in terms of, the practice coverage and then service delivery?
So we have currently 21 plastic surgeons. To be a plastic surgeon, you should have written the primaries to enter to the surgery program. After about 3 to 4 years, you write what we call the Part 1. When you pass your Part 1, you have about 3 to 4 years to specialize as a plastic surgeon. So it's a long journey, and these are people who have gone through the training through primaries, through part one, through the rigors of training of becoming a plastic surgeon. So those who are recognized plastic surgeons in Ghana are just about 21. We have them in Kolebu, Konfanoche. We have one in Cape Coast, a lady surgeon in Cape Coast. We have one at University of Ghana Medical Center, two in Ridge, and I'm at Teta Military Hospital.
I see, but the World Health Organization, said that for every country, for a plastic surgeon, you need about 1 to 100,000 residents. But for Ghana, like you're saying, you're about 21. Are you the 21st person, I would say?
I decided to do plastic surgery because at that time in medical school, there were 4 plastic surgeons in Ghana. And I told myself I'll be the 10th. I became the 14th.
I see.
So I'm the 14th.
But why so few? Why just 21? We need 300.
It's difficult. It's difficult. Let me put it this way. The neurosurgeon will call you in to assist him. He expects that you should know brain anatomy. The ophthalmologist has a difficulty. You come in, you should know anatomy of the eye. If there's a tumor in somebody's mouth and the dental surgeons call you, you should know your way around the oral cavity. So
are people not just interested because it's tedious, like
the training is tedious. The training is involving maybe and the interest. You should be interested in doing it. I have a very tight, difficult schedule, but I enjoy it. So the interest should be there. If the interest is not there, it's difficult to do it. But the training is tedious.
But do you see enough commitment, channeled through the development of human resources in the field? I mean, the reconstructive field in Ghana. Has it ever been like a priority at all?
No, it's not. It's not. Even when I wanted to do plastic surgery, of course, I had a few people ask, why I want to go and change somebody's nose or want to change somebody's face. The conception about plastic surgery, it is plastics reconstructive burn surgery. We take care of burn patients. We do all the deformities, and sometimes you have to reimplant a finger or reimplant a wrist, a hand that has been cut off. Somebody goes to fight.
So how do we now change the misconception? How do we change
This is helping. A program like this helps. Generally, the impression about plastic surgery is that it's cosmetic. Somebody wants to do a boob job or enhance some part of. And so there's generally that misconception. And so once they hear you're a plastic surgeon, of course, I've had people walk to me and ask me, tell me how I'll go to hell because God has created and I want to change, So general impression is that plastic surgery is cosmetic. But with time, and as more of us are getting into the field and as people need the service of a plastic surgeon, gradually we'll get
So in your view again, how can we increase the numbers of plastic surgeons in Ghana?
Such a program will help me or will help us. I and other plastic surgeons actively encourage medical students to get into the field. And one thing that is helping, increasing interest is an arrangement we have with Research Africa. Research Africa helps the training of plastic surgeons to do a part of the training in Glasgow. And so, so the first Ghanaian plastic surgeon trained in Scotland. So Scotland is our mecca. We all have to go through Scotland as part of our training. And there's an arrangement with. So sometimes once young doctors hear about this avenue, they get interested. Also, we are having, initially it was only the West Africa College. Now we have the Ghana College. Ghana College, West Africa College is, a college for all of West Africa. And sometimes getting into the program is more difficult. Luckily, we have the Ghana College of Surgeons. And which
is it expensive? Apart from it being tedious and you have to know a lot, is it expensive for people to, to deter them from not taking part in it?
what I'd say is, while you are working, you are doing the program. We don't stop, like, sit in the classroom to do the training. So you are working, you are being paid. But the main thing, I would say this, the main thing is the interest. If, even with residents I'm training to become plastic surgeons, or I'm hoping to train to become plastic surgeons, there are some who are just not interested. They just don't have that zeal to do it. For me, it's the zeal, it's the interest. There are avenues, there are opportunities, and so on. There are arrangements,
right?
But the interest.
Let's look at comparison. If you compare Ghana to some other West African countries, how is the development like in terms of the plastic surgery sector?
In West Africa, I think it's only Nigeria that has more plastic surgeons than us. Sierra Leone recently only had their first 2 plastic surgeons. I trained with them while I was in Kolebu. Some countries, I think Cote d'Ivoire has 1 or 2. Togo doesn't have any. Benin doesn't have any, as far as I know. Actually, I have been traveling to countries in West Africa, to sometimes to Nigeria, to Cote d'Ivoire, to Sierra Leone, to do.
Yeah, so you don't have plastic surgeons in some of these countries.
No.
So how do we use this to advantage? Because I know people come from elsewhere, Kolebu.
Yeah, so people come from other countries.
Yes,
we've had people coming from other countries. I've had patients coming to me from Cote d'Ivoire, from Sierra Leone, from Liberia, to assess our skills and our facilities. So we are not there yet, but I think we are much better than. But we'll get there. As of now, we have quite a number.
It's all talk. How do we get there? I mean, how do we get there? We'll get there, but how do we get there? Because we don't have them. So I was telling you initially that we have people come all over the world to Kolebu, even to 37 for some serious, specialized treatments, but we can use this to advantage, can't we? We talked about Benin, we talk about Cote d'Ivoire and all these other countries.
I'll say it 1,000 times. As I'm training surgeons, if we don't have somebody who's interested, you can put all the whatever available, they will not be interested. However, we're also having discussions. Ghana College of Surgeons is also making arrangements. What makes it difficult sometimes is that to become a plastic surgeon, you have to do all of the surgeries, learn all the surgery before you now specialize.
Everything.
Yes. You have to learn everything. So you should know general surgery, you should know neurosurgery, you should know pediatric surgery, you should know all the surgeries before you now come into specializing plastic surgery. There's also an option of getting doctors to go straight through plastic surgery, so that we have them training as plastic surgeons from the scratch. There are also talks to have sponsorship, and also to have people pay for if we could have the government pay for training of residents. Sometimes we have situations where even paying for examination fees becomes a problem for some people. And if these can come through, let me say it again, we'll get there.
I hear you. But in many developing countries, plastic surgery is usually considered a non-essential super specialty service. And sometimes, even here, when it comes to some budgets, or when government is even allocating some money to these departments such as yours, it's really not a priority. As 37, is that a priority at 37 right now?
The difficulty for me is the fact that as of now, I'm the only plastic surgeon in 37. And I also take it as an advantage. And so when I make certain demands, it goes far. For example, there's some methods and there are some facilities there are some equipment that I make noise for and I get, since I'm the only plastic surgeon available. And so microscopes for surgery, for doing microscopic surgeries. There's also the MIC machine, The Nick machine, the Nick skin graft machine is an equipment we use to graft for wide areas for skin grafts. The teaching is that if somebody has more than 10% body surface area graft and needs more than 10% body surface area graft, it will not be successful. But with the MIC method, and I made an appeal to the then Chief of the Defense Staff, Lieutenant General Aqua, and he made monies available for that. So we are gradually moving away from the impression of only cosmetic surgery, and people are gradually getting to understand.
But Doc, it's just you. So if you have like 10 burns or even 3-4 burn cases, serious burn cases in a day, how are you able to handle all of these cases?
I work 24/7. I work 24/7. Every day I'm at work.
And it's just you. So again,
so I'm training, that's why
priority-wise, how do we get more people? We talked about that. We'll get there, but it's like a national concern right now. How do we ensure that we have 4 or 5 cases in a day? You know, of course, you work 24 hours, but it's just you. You're alone now. So how do you get more people like you?
It's a training. And as an interest, that's what I would stick to. People should be interested in it. Like I said, Ghana College is making plans to have a direct plastic surgery program. Once we get there, we'll have more plastic surgeons. And we should have people who are interested. That's it.
You indicated again in 2017, one of your interviews in 2017, that you have to improvise during your surgeries because the right instruments, are not available sometimes. What has been, I would say, the implications for you as a surgeon in terms of work output and your patients in terms of, quality of treatment?
I have had times where I've had to buy my own instruments sometimes, buy my own sutures sometimes. I can't tell the patients that because these were not available, your surgery didn't go well.
Who is responsible to provide some of these things for you?
So, some of them are difficult to get. They are not available.
I thought you said you make noise and
so
then you get some of the
things. I can't get everything.
But these are like basic things that you need.
Another thing that comes in is the poverty. My patients sometimes can't afford some of these things. And poverty sometimes makes it difficult. And so sometimes I have to pay for their drugs, I have to pay for some of their medications. I have to sometimes make appeal to get people to sponsor some of their surgeries.
But do we have an intervention at 37 that takes care of some
Yes, there's an intervention at 37 where you could see there's a welfare, there's a payment plan sometimes. And at times...
So why then put your money in it if there's a payment plan for some of these patients?
You see, the payment plan will happen later.
But immediately.
Immediately until then. I go in to do a surgery that takes me about 7 hours. After surgery, patient is screaming in pain. Yeah, of course, the interventions will come, but sometimes I have to make some myself available.
Has the situation improved?
Oh, it's getting better. Actually, it's getting better. Things were quite difficult when I started started practicing first at 37 after my program. I was done with my program. But it's getting better. People are getting to understand me. People are getting to understand my situation. Yeah.
You're still watching The Hard Truth. We'll be right back. Welcome back. You are still watching The Hard Truth. Surgeon Naval Captain Kwesi Okumanin in Nsaful. Yeah, you should know the meaning of this name well. Anyway, he is the head of plastic burns and reconstruction unit at 37, or burns and reconstruction unit at 37. Am I right?
Yeah.
What are, again, your suggestions for a better fulfillment of the objectives of a plastic surgeon or a surgical unit or a center? What ought to be done and what ought to change?
Theaters. Theaters should be available. We should have theaters available.
Separate theaters for that?
That means, yes, I should have theaters available specifically for plastic surgery. Because there are times where other surgeries are deemed more essential, not just in 37, but in somebody has something more important. Why should plastic surgery go and do a case, sometimes? So we're looking at setting up more theaters strictly restricted to plastic surgery.
Have you started?
Yes. So the 37 Military Hospital has plans of setting up whole new units.
Plans? When are we started?
It's been marked out. It's been demarcated. The place is ready to be started. I've given my specifics.
Or
yeah, construction should start before the year ends. So
and how long is that going to take?
I can't give you the specifics, but I've put in all the details I need, and so we're going to get more space. There's also the building of the cardiothoracic center at 37, and there's theater space for the plastic surgery unit. So once we have more theater space, of course, as of now, patients who came to see me on Friday, some of them got November and December for their theater days.
You schedule them for November, December?
Yes.
Why? They are not
because
serious cases?
because there's a long list. There's a long list. My theater days are Wednesdays and Thursdays. I do at least 6 or 7 on every list. And I have that long list all the way till. And at times I hope no holiday falls on a Wednesday or a Thursday, because once a holiday falls, then I get to have a backlog. And it's all because the theater spaces are not available. There are cases that my residents could do. And so if we have more theater spaces, we could have. So while that is done, together with the equipment, things will get better.
Let's now shift our focus to cosmetic surgery. I want to know, what is that cosmetic surgery and what kinds of procedures fall under this option?
Yeah, so when it comes to cosmetic surgery, it's everything from head to toe. Head, like correcting people with alopecia, what we call motorway. And we can correct that all the way to people's toes, when people have what we call overriding toes, or toes not well formed. So all of that, it's improving upon what exists. It's not creating something new, but improving upon what exists. And the common ones are what we know about, maybe a rhinoplasty, facelifts, breast surgeries. And there are times and for now, because we also do reconstruction of breasts for ladies who have had to lose their breast because of breast cancer. And so that option is available, where we create a new breast for you after you've had to lose your breast because of breast cancer. We have...
But it's also believed that it's, virtually everything that you can visualize. So if I visualize having like a super slim waist or a super big head, it's something you can do. Let's come to, someone said, personally, how do you really view that, changing the norm to something superficial?
It's a matter of, it's called enhancement. It's called lifting up people's some people have low esteem, and so that lifts up their, some stay indoors, some refuse to step out, some become more outgoing once the surgery is done. There are some to the therapeutic. For example, some ladies have come to me or have been referred to me because of severe back pain. And the reason why they have the severe back pain is they have big breasts. So the breasts kind of pull them down. So headaches, back pain. So sometimes we have to do a breast reduction to reduce the load. And that takes away the back pain. I've had ladies with big tummies come back to tell me that after the tummy tuck was done, their back pain is gone. Some after a tummy tuck or liposuction, once you reduce their weight, their knee pains go away. So it's not only the cosmetic, it's not only beauty being sold, it's also a matter of self-esteem, it's a matter of enhancement, it's a matter of therapy.
I had this very cute lady asking me, can doc make me tall? I mean, if you are short, and I want to enhance my esteem and tall a little, is it possible?
Yeah, so there's the Lizarov method, I think, where you can actually lengthen bones. I saw it done once in one of the orthopedic surgery, theaters in outside.
You can make someone tall.
Yes, there's a way of lengthening your bones, and and it takes a period of time. You gradually lengthen, and then allow the bones to form and keep on lengthening. And yes, you can increase.
Break, doc?
No, it won't break if it's done well. I've actually had surgeries where.
But can you do it?
For example,
can you do it? Can it be done in Ghana?
What I have done before, the lower leg has two bones. So if I have a patient who's lost one of the two, the bigger of the two, I move the smaller one to fill that space where the big one was, and it fits, and they're able to work on that.
And they become tall.
They may become tall if it's done well. Yes.
Wow. Anyway, let's talk about costs. We really can't talk about that without, bringing up costs. How expensive is cosmetic surgery in Ghana?
I know people go outside and do it. It's cheaper than going outside to do it. Let me put it that way. It's cheaper than going outside.
How much is it? Okay, technically. So I want to get like a tummy tuck and maybe how do we call them?
Okay, so generally we're going to do maybe a breast lift or a breast reduction, breast augmentation. Augmentation may be with silicone implants or with maybe fats. Harvest your fat and put it into your breast to enhance it. So depending on which method, the silicone implants is about $1,000 per implant. So
2,000.
Yes, and then and the cost of the surgery itself. A breast lift may be about 25,000-30,000. Yes.
30,000
Ghana cedis, not dollars. No, Ghana cedis. Somewhere around that area. A tummy tuck or liposuction, anything between 40,000 to 60,000. And that is not the cost of the surgery. That is not the cost of the surgery. That's not the cost of the surgery only. As a surgery, your medications, your admissions, by the time you are done, by the time you are out.
So if it's cheap, to me it's expensive. Like really 30,000 for my stomach, and so why then do people go outside to do it? Is that we don't have a professional?
Thing is, of course, the thing is this, that people don't know it's done in Ghana. Quite a number of people don't know it's done in Ghana. There's the medical ethics of not advertising. So I don't advertise. It's for me, it is doing for somebody and the person telling someone that it's done. So people don't know.
So when we want to do whatever, we can come to 37 and it's done at 37.
It's done
at 37
by me. I mean, some want it there, some want it at private places. I mean, it depends, but mostly people would prefer to do it at a private place.
But many believe this is for like the rich and famous. Could they be right? You know, plastic surgery is for, or cosmetic surgeries for the rich and famous.
Everybody.
Where will I get 60,000 from, doc?
Oh, there are people who come and see me. For example, I spoke to somebody today, planning to do it in December. So she's come up with a payment plan, or some also have a way of saving towards it. Our people who have saved for it for 2 years to get it done. So people actually save for it. And like I'm saying, it's...
What will it do for you as a person at the end of the day? Because I'm 60,000. So after that, what are some of the things you hear from your clients? What does it do for them?
I get a lot of blessings.
Hey, sir. Like what?
No, God bless you. Thank you very much. To start with, a lot of people have the fear of complications, the fear of losing their lives, and so on. So to go through it safely and to get the results that you're looking for, it's a miracle. It's amazing for a lot of people. And a lot of people have told me it's worth it. I've had people tell me that, with ladies, a lot of ladies lose their form and shape after pregnancies. Sometimes the pregnant uterus pushes the muscles apart. So we have the muscles being torn apart. And so they're everywhere they go. People ask, are you pregnant? Hey, you are pregnant again, and so they stay at home. Some spend so much money buying corsets. Actually, somebody
I was going to ask you,
spend so much money
going
buying
to the gym
corsets.
and all that, can't it fix it?
You see, when your muscles have been torn apart, the more you exert yourself, the more the contents of your abdomen pushes against the muscles. And so sometimes, the more you exercise, the worse it would become. The corsets would only hold it in place whilst the corset is in place. Once the corset goes off, things would fall apart. And I've had people explain to me that they spent actually more money buying corsets over the years than how much they had spent doing the surgeries. So like people save towards it, and the esteem, they get it back. I had a patient who told me to advocate that all husbands should do it for their wives as presents.
I see.
After they've carried children for them.
For them.
So
yeah. Who is like a good candidate for these things, especially?
You should be healthy.
Apart from that, so you mentioned pregnant women. So if you're a pregnant woman,
after pregnancy, there are times people are hoping to get a tummy tuck as part of a cesarean section. We'd want, your muscles are stretched, there's still a lot of estrogen, so your muscles are loose and stretched. We'd want you to totally recover. So we may wait for up to about 9 months, where the muscles are falling back in place. Then we know what we can correct. So women after pregnancy, like I've said, ladies with very heavy breasts, a lot of them are going through some are having headaches, neck pain. There are some who come with very bad sores under the breasts because it's rubbing all the time. They end up with rashes.
So do you deny certain people, of the surgery?
Yes, if you are not medically fit. There are times we've had to actually wake people up from surgery and told them we couldn't do it.
No way.
Yes, because you put them to sleep and then their heart readings are looking suspicious. This is surgery that it's not an emergency. So sometimes if you have something wrong, a disease condition which is not well managed, like you have a cardiac issue, or your kidneys are not working well, or your blood levels are low, or you have a thyroid disease, which is not well controlled, would want you to correct it, and we get it done. However, if you are hypertensive, diabetic, well controlled on your medications.
If you're not healthy, you can't take it.
I've had a patient come see me. I refused to do it. She went to Dubai to have it done. Lucky for her, whichever doctor saw there also refused to do it. I've had a patient try to do it with me, ended up in Nigeria. Now, after had issues, now had to come back to me, explain that, well, you said no, but I went elsewhere. These are the troubles I have now. Help me out. So I'm very careful with my choice of patients, and yes, most plastic surgeons are.
Let's look at the framework, that governs these things. Do we have anything like that in Ghana, like a framework that supports consumer rights or patient safety at the cosmetic surgery? I mean, when you do it.
What Medical Dental Council does is to constantly come out with, there's often yearly, there's a list of doctors, and their specialties are spelled out. People also have the choice to choose where they want to go. I know colleagues
that framework, because HIFRA has it they regulate all the hospitals. So yes. You go to certain hospitals, you see they have that.
Yes,
so you are accountable. So what do we have when it comes to
Medical Dental Council has its plans, it has its regulatory methods. Attempts have been made to streamline things. We also have the lead in forming plastic surgery Association of Ghana.
Don't we have any certifications? Do we have any certifications available, and how effective is the regulation?
The certification is that I am a fellow of the West Africa College of Surgeons, plastic surgeon.
So if I go to anywhere, a hospital, what am I supposed to look out for?
You should look out for a fellow of plastic surgery. Either is a fellow of Ghana College, fellow of West Africa College, a fellow of Royal College. He should be a consultant plastic surgeon, trained and certified. The fact that people say I'm a plastic surgeon does not make you a plastic surgeon. Like I've told you, to be a plastic surgeon, that's why I'm saying it's difficult and the interest should be there. To be a plastic surgeon, you should have, if after this right here I get a call from cardiothoracic that they need me to assist them in a surgery, I'm expected to be able to perform. I can't call them and say, I don't know this area very well. Another problem we have in Ghana, let me put it this way, is that because of our few numbers, we don't have subspecialties in plastic surgery. And so every plastic surgeon, all the 21 of us trained 21 plastic surgeons, are expected to be able to do all plastic surgery cases, be it cleft lip and palate, be it eyelid reconstruction, being ear reconstruction, being
so you do everything.
Whatever. Yes.
I see. What's the minimum age? I mean, if I want to get something done, do we have any minimum age in Ghana?
Let me put this way, the youngest patient I've done surgery on was 63 years. 63 years. She says life starts at 70, so she wants to. Once you are well and healthy,
so there's no age limit whatsoever.
There's no age limit. I, of course, would want to be sure you are well and healthy. So somebody 63 years she had a breast lift with a tummy tuck.
63.
Emma, she's saying she wanted her breast to point at the men. So, yeah, she had a breast lift, she had a tummy tuck. There's really no age limit. The youngest person I've ever had to do was about 18 years.
But really, Doc, do you think that people who have these cosmetic surgery are always happy? Are they happy with the results?
Well, I'm saying most of my patients have been very, very happy. Of course, you can't please everybody. I mean, I've had some patients who, sometimes when people come, I try to give them an idea of what they should expect. Some come with very wild, big plans. For example, somebody comes in and I tell you that you need a tummy tuck, not a liposuction. So liposuction is just sucking out the fat and then allowing your skin to fall down. But when you have skin folded over, if I do the liposuction, you have loose skin hanging. But sometimes they want to insist that no, I want it, and that sometimes brings issues. So sometimes people come. I have people come with a picture of what they want. This is what I want. But you've come the picture you're holding or the drawing you have has a very different structure, different figure from what you. So like I'm saying, we don't recreate when it comes to cosmetic surgery. We only enhance what you have. So if your bones are this wide, I can't reduce your waist bones to this.
You see an obolo person, then later on you see that there's...
No, so what we would do would be to work in the work in the midsection. Okay, so we can work in the midsection. So where there are no bones, where there's only fat and soft tissue, we can work there and get it to get narrower. But we would not be able to do anything about your wide pelvis. So that's it. So people come with too much expectations. Some ladies who want enhanced backsides and hips. For some of them, I have to explain to them, one surgery will not do. We need to do more than one. So I've actually had patients who come, get some, go eat, put on weight, come, take, we put it there.
I see.
So a lot of times I need my patients to understand that this is so much you can get.
First 60, second 60, third 60. I mean, when you come again, first 60, second 60, third 60.
Maybe not. Sometimes there's an arrangement.
We'll be right back.
Yeah.
Welcome back to The Hard Truth. Dr. Nsaful Okumanin is still here. Doctor researchers, believe that cosmetic surgery's obsession is linked to, psychological problem. First of all, why would anybody want to do several of, these days?
So, for example, somebody comes, the person, by my assessment, needs a breast lift and also needs a tummy tuck, needs a brachioplasty, as in to reduce her arms, needs to liposuction, needs to take fat away from her back. So she needs about 4 procedures. It will be too dangerous to do, I may deem it too dangerous to do all 3 or all 4 at one sitting. And so we'd have to do it in stages.
For someone,
but
there's nothing wrong with them.
But there are some who come and I refuse to do it. I don't do it because when I think they don't need it, I explain to them why they don't need it. Some, like I said before, come with unrealistic goals.
No, but some do it. They still want their nose like pointed down and zigzagged, and I mean it's like sheer obsession. So in such cases, how do you handle it?
I explain to them. I take pictures of their face, or if it's the nose, take it of the nose. Explain to them why nothing can be done or why surgery should not be done. I may show you your abdomen and explain to you, if you do it this way, this is the results you're going to get. You won't be happy with this. So I take my time to explain to them. Those who have those I think don't need it. But yes, so it's not everybody who comes. In a week, I get to see about 8 to 10 people who think they need cosmetic surgery of one sort, one form or the other, and it's not all of them that get to do it. That, of course, there are some who would go seek an opinion elsewhere. I mean, that option is always available. But a lot of times, I see a patient and you go elsewhere and you tell the person, a plastic surgeon, that I saw you and I didn't do it, then it's likely it's not going to be done.
I see. So what are the dangers associated with that cosmetic surgery?
Okay, so the main thing I worry about is deep vein thrombosis and then pulmonary embolism.
Is what?
Deep vein thrombosis, as in blood clots in your legs and dislodges and ends up in your chest. That could be catastrophic. And so all the methods available to prevent it, I make sure I deploy them and I employ them. So I've been doing these surgeries since 2013, and I've had only 2 patients who have had it. Of course, I mean, we manage them. They are still working around happy. So the thing about these surgeries is for you to think about all the possibilities and anticipate them and expect them, look out for them, and you're able to catch them quick. That's the main thing. Occasionally, of course, we may have wound infections. The wound may get infected for one reason or the other. That will only mean we get to do dressings for a longer time. But I'll take infections, I mean, they may happen. But a lot of times, if the dressing is properly done by a plastic surgeon, you may end up with a scar that doesn't look too bad. There's other complications, but they really are nothing much to worry about. The main thing I worry about is the pulmonary embolism.
The blood clotting.
Yes.
I see. Patronage of this, surgery procedure has witnessed like an increase in recent years. Generally, what should I attribute this to? Why is that? All of a sudden, everyone is conscious of how they look.
It's affordable now.
It's affordable.
People have realized that.
80,000.
People imagine all sorts of things, So people have found out that it's quite affordable. They can save towards it. People also have found out that it's done in Ghana and it's safe. There used to be a stigma about people who have done such procedures. Now it looks like if you have not done it, you are rather the odd person. So sometimes there are a group of friends who, everybody should have done it, So,
but Doc, I look fine. I don't need plastic surgery.
What I'm saying is,
Doc, do I need plastic surgery?
No.
I don't.
Let me tell you this. There are times I have somebody walks into my consulting room, tells me I need a tummy tuck or I need something, and I go like, oh no, you don't need it. Then they take off their corsets, and I go like, hey, or they take off their foam pads, and I realize that I wish I could do it for you today. So sometimes people have things are covering things, things are covering
no, that's
things.
me. Nothing is covering anything. But we also previously.
I also think that it's because that stigma has gone. So people are happy to say it. In times past, I've had people being interviewed and being asked whether they've had the surgery, have had any form of cosmetic surgery, and then they would swear heaven and earth, no, I didn't do that. But I have done it for that person, So so gradually people are getting to understand that yes, it's done. So the surprise and the shock people initially attached to the fact that people have done such surgeries is gradually going down.
I see. But previously, cosmetic surgery was just mostly patronized by women. But these days, you see our men, taking part in it. What's accounting for that? For men, what's accounting for it?
We don't want to be left behind. So there are men who come with pot bellies to get a tummy tuck done or a liposuction done.
For men?
Yes, for men. So I've done liposuctions, I've done tummy tucks for men. Of course, and some men come for a rhinoplasty. I've done a few rhinoplasties for some men. So, so men also patronize plastic surgery.
There's also a school of thought that,
There's some men who come because they've been gymming and they're not getting the six packs. They want to get the six packs. With the liposuction is the solution.
So you build it for them?
Yeah.
I see. What of this? A school of thought that, plastic surgery should be restricted to only reconstructive procedure. What are your thoughts on it?
You see, once there's the knowledge, once we know how to do it. For example, sometimes we didn't know we can reconstruct somebody's ear. But now we know we can reconstruct ears. So people now come up. There are people who have had a deformity all their life and they appear and you ask them, why are you now coming? They go like they didn't know it was done. So now we know it's done. Now people know there are the skills to be done. So once that option is available, you can't restrict anybody that don't do this kind of thing. Trust me, I do more reconstructive surgeries than I do cosmetic surgeries. So my Wednesday, Thursday list is full of reconstructive surgeries. The first will be somebody's hand, the second will be somebody's ear, the third will be somebody's leg ulcer, the fourth will be...
You've done a lot of PR today. So from your perspective...
Just let you know.
I get
that,
it.
And also, maybe about burns. We also have a lot of work with burns. Of course, when it comes to plastic reconstructive surgery with burns, that is the burns part is the part that most plastic surgeons don't enjoy because burn management can be very taxing and very difficult. And
that's when the grafting comes in, I'm guessing.
That's when the grafting comes in. But the first main thing is you should keep the burn patient alive till they need a skin graft. Your skin is your first line of defense. It's protecting you from bacteria. It's keeping your body warm, it's keeping water in. And so you should be able to keep the burn patient alive until you get a chance to go cover their skin. One advantage of cosmetic surgery is sometimes I borrow skin from some of the patients who are doing the tummy tuck, and I use it as temporary skin cover for some patients.
You borrow someone else's skin?
Yes. Your body will reject it. I mean, a burn patient who is very unwell, your body does not notice that foreign
different thing.
So you use it to buy time, and as the patients get better and they are healing from under, they begin to reject the skin. But by the time they reject the skin, they are much better, well enough to get their own skin, well enough to go through the surgery to get. There are some burn patients that I've had to do about 20, 21. I think the record's about 25 surgeries on one burn patient because you have to keep on going after and after. So burn management is difficult, and that's the no sign when it comes to my field.
I see. So from your perspective, how does the future look like for Ghana in terms of development of our plastic surgery industry?
So for example, in 37 military hospital now, there are about 8 very young, very enthusiastic surgeons training to become plastic surgeons. Kolebo has almost about 16 training. Konfanache. So the main place at Kolebo, Konfanache, 37. Kolebo has about 16. Konfanache has quite a number. So looking at these numbers, like I said, I decided to do plastic surgery because there were 4. I was the 14th. We are now 21. So with time, the numbers should double. We'll not get to the 300 or the 350 anytime soon, but once we get up to about 30, 50 plastic surgeons, things will look good.
So cosmetic surgery is not a sin?
It's not.
It's not?
It's not.
Right.
One reason why I know it's not a sin is that I pray before each of my cosmetic surgeries, and God always answers me.
So it's not the same.
No.
All right. Thank you so much, sir. For
Can we
talking
shake
to
hands?
the heart. Yes, we can. So, the Sergeant Naval Captain Kwesi Okumanin in Nsaful is the head of Plastic Burns and Reconstruction Unit at 37 Hospital. You should share your thoughts with us on our social media platforms. What do you make of this subject? Plastic surgery, cosmetic surgery, all of it. Share with us on our social media platforms on your screen right now. You have been watching The Hard Truth. My name is Nana Akusia Kunila Santos Samuels. Thank you so much for your time. Have a good evening.